Trust Focus, we launched the 2016 Listening into Action work that we're going to undertake at the Trust. We've got 13 big ticket opportunities looking at in-depth topics, areas that where we want to improve care for our patients.
In maternity, our focus is about improving continuity of care for women using the service. At the moment, the service can be quite fragmented and they can see more than 1 or 2 or 3 midwives in their journey. And we want to reduce that so that they see no more than 2 midwives in the maternity pathway. That's our aim, and this is going to make it a much better experience for the women. They know they are part of a team and they know their midwife that's looking after them.
Everybody out there in the media and the general public understands the 4-hour standard of care. It's classified as the A&E target. You can't stay in A&E longer than 4 hours. And over the last 12 months or so, we have got considerably better and better at Croydon Health Services in making sure that the vast majority of our patients do move on to a safe place of care or home within 4 hours. But unfortunately, now and again, for various different reasons, we don't get it quite right. And so what we're trying to do as a team is look at the occasions we don't get it right, and understand what went wrong. And invariably what we found is that the common factor is around communication. So our big ticket item is that we want to really look at the occasions where we get communication right, so that we can do that all the time, every time. And if we do that, not only will we currently be the 4th best trust in London and perhaps the top 20 in England, we may well even climb to the heady heights of being first, the best organisation in the country.
So I've taken on this LiA project where I hope to improve the consent process for patients who cannot consent for themselves. And although this is restricted to endoscopy at the moment, we hope to spread it out to the rest of the trust once this mission is accomplished.
We've delivered so many actions and have so many improvements in different areas, and we think it's about time that we take Let's Do It to another level. So we're asking every member of staff to get involved in blasting out the day-to-day frustrations that's impacting or affecting the way we deliver service or our working environment, or even the way we relate with one another across the organisation. So get involved, let's do it, blast out frustrations out of Croydon Health Services.